one of the questions is, why does LGUs have different standards on dealing with recovered cases? Some of them are still recovered patients for RT-PCR testing. Based on the discussion earlier, testing is not needed for those deemed recovered, right? And how can we bring it down to the LG level na these requirements di na kailangan?
So, sir, yeah. Okay, so we try to put in standards, pero we understand that some of the LGUs actually are in different stages of the pandemic, no? So some of them have actually so some of the LGUs are in the parang earlier stages of the pandemic, and how they describe it to us is that they're having difficulty explaining it also to reassure their constituents. No? So I think a lot of it relies on constant reassurance and frequent, I guess, emphasis on the science of the recovery. So it's not just actually the local chief executives, but also their own health staff, as well as the barangay leaders, the community leaders who may or may not actually be comfortable receiving the patients back into the community unless they actually see the test result. So yes, sir. So it's actually more a mix of just the knowledge part with the, I guess, psychological part of hindi na ba talaga sila nakakahawa.
And then yung second question, a follow-up on that. One of our participants asked, if there are 2 confirmed cases of COVID case in the company, will this be a scenario for temporary closure of the workplace? And if it is, how long would you recommend?
Actually, sir, based on current guidelines and discussions, it's not mandatory, no? So we recognize that, for example, we are in NCR and workplaces are huge, diba? Some of the factories will have different buildings, etc. So it's actually unfair and non-scientific anymore to lock down the entire office, no? You just need to have localized disinfection, and that disinfection could run between 4 to 8 hours. So it doesn't even need to be locked down for 24 to 48 hours. So, pero na po tayong protocols for that, localized disinfection lang yung kailangan, and then contact tracing.